Zandy, whenever you're ready, please go ahead and get us started.
Great. So we'll advance the slides, Zandy, and start off with the promise of community action this afternoon. Community action changes people's lives, embodies the spirit of hope, improves communities, and makes America a better place to live. We care about the entire community, and we are dedicated to helping people help themselves and each other. So always a good way to start off with the promise, and I think it's a good lead-in to my opening remarks today. We've been planning this webinar for a long time. We actually started discussing having our colleagues from Annie E. Casey and the Urban Institute talk with you today before COVID-19, before any of the protests against the racial injustices that exist in this country. We've been planning for a while, and I'm so excited to have folks on the call today presenting to my community action family, folks who have been studying and learning and practicing some really important work that I think is really timely for the moment that we're in. So I'm really excited that the partnership is able to bring you this webinar today. Just some initial context and setting the stage a little bit. Many of you on the call from Community Action know about the Learning Community Resource Center, and you know that through the Learning Community Resource Center, we've been supporting, many community action agencies around the country who are trying to serve parents and children together in a whole family or a two-gen approach, or agencies that are trying to pursue community initiatives to make their communities a better place. We've had learning community groups on whole family, on service integration, on community revitalization, and we've all sort of, as a network, 1,000 community action agencies, been engaged in learning and thinking about these strategies or interventions to address the issues in communities. And we know in community action that it takes both working on the family and community level to create change. And one specific community, learning community that we've had, a community of practice, is the Community Action Economic Mobility Initiative that was actually funded by the Annie E. Casey Foundation, like some of the work that we're going to hear about today. And that initiative really helped 10 community action agencies go deeply into thinking about shifting their agency to a whole family approach. Probably many of you on the line today have heard those community action agencies talk about their journey, and many of them have been highly successful in working to serve both parents and children together. Some of them have also been engaged in community initiatives, community collaborations, but we're going to hear today about what that really looks like when you bring a two-gen lens and a community initiative lens together. So just in case you're a little new to the conversation, we wanted to highlight, when we talk about two-gen, you may hear people say two-generation, you may hear folks say whole family approach. Regardless, what that is really bringing great intention and great high-quality programs to serve parents and children together, with the idea that if we do that, we're going to improve efficiency, we're going to be able to have better outcomes for families and children, and perhaps break the cycle of poverty. So two-gen whole family. And we really use a theory of change or a model when we're talking about that has been developed by Aspen Ascend. And their theory of change around this talks about parents and children families, and families certainly define themselves. Families can look a lot of different ways. Bringing a range of services, health, social capital, economic asset, post-secondary education, early childhood, meeting families where they are in those areas to help them strengthen. And if we do this and we do it right, that has an impact on the whole community, and families can thrive and we can improve well-being. So that's sort of our general theory of change that we operate off of for our whole family 2-gen efforts. So we're going to hear from a range of people today, and we're going to learn more about this family-centered community change effort that Annie E. Casey came alongside 3 communities and supported over 7 years. But before we sort of delve into that, and I want to move right into that as quickly as we can, but I did want to sort of emphasize this point for all my community action friends out there listening today. We really do stand at a moment where perhaps it's never been so clear that we have to address people's and families' emergency needs and their needs to create their own family stability, but we also have to address community level issues, and we have to address systemic racism and address the policies and the power issues that exist in communities in order for families to really thrive. And this is a statement I'm going to pull from this report that you see there in the center, the Family-Centered Community Change Report. And I think this quote from that report will really says it all about how important this work is and how we have to make the most of the moment that we're in. And there's a paragraph in this report that says, lifting whole communities out of poverty requires both systemic solutions that address structural barriers and targeted interventions with families and their children. Local leaders cannot service their way out of poverty. Chronic disinvestment and a long history of local, state, and federal policies that have discriminated against people of color created the impoverished conditions in which too many families are forced to live. Turning this tide will require comprehensive policy solutions that create more equitable pathways to opportunity, coupled with services and resources that help both children and their families to achieve stability and succeed. And I'm so excited today to hear from researchers and practitioners that have actually been working on both the community level and the family level to help families thrive. So right here there are examples of 3 reports that sort of outline some of the findings of this initiative, and we're going to move right into hearing from our wonderful friends at Urban and Annie E. Casey and the local practitioners from Ohio. So let me sort of introduce those folks initially, and we have a slide here that sort of shares who you're going to be hearing from today. To keep things moving, we've asked our presenters to kind of pass the speaking baton to the person behind them as we move forward. And I'm going to just pass the speaking baton to Tracy Callender, who is a senior associate at the Annie E. Casey Foundation, a good friend of ours and a friend to families that are striving to thrive. The Annie E. Casey Foundation, we thank them for their support. And Tracy, I'm going to hand it over to you.
Hello, good afternoon, everyone. I am Tracy Callender, a senior associate at the Annie E. Casey Foundation. I am on the National Community Strategies team, where I lead our family-centered community change work, and I've been there since June 2019. Okay, so just a little bit of background. In 2012, the Annie E. Casey Foundation launched Family-Centered Community Change, which we call FCCC. You will hear me use that acronym throughout the presentation. FCCC was designed to support local partnerships as they developed a more integrated as they developed a more integrated set of services as housing assistance, quality, high-quality education, job training, both to help parents and children succeed together, as we talked about earlier, the two-generation approach. Rather than creating something new, the foundation joined these local partnerships, provide technical assistance, trainings, peer learning opportunities that built upon their existing community change efforts. Just a little bit more background. The foundation has funded numerous community-led efforts and initiatives based on our lessons learned. Here are some of the key elements that we have found to be proven to be important in community-led efforts. We were looking for strong backbone organizations, buy-in from a diverse group of organizations, commitment to both resident leadership and engagement, sustained affordable housing options, public and private funding sources, and a focus on data to drive results. Again, just some key takeaways, not necessarily supposed to be the exhaustive list of what we were looking for, but definitely the things that were floating to the top. In addition to the elements that I previously outlined, the foundation also sought to join collaboratives to improve the well-being in 3 different areas. And so family well-being when it comes to economic stability, parent and family engagement and leadership, and early childhood care and education. So we ended up awarding 3 grants to neighborhood-based initiatives in Buffalo, New York, Columbus, Ohio, and San Antonio, Texas. Each partnership had a comprehensive community change initiative underway, as well as a history of cross-organizational collaboration and a commitment to resident engagement. Buffalo's efforts stem from the Federal Promise Neighborhood Grant and was anchored by a really strong partnership with M&T Bank and a public school system. The Dual Generation Initiative in San Antonio was awarded a Promise Neighborhood Grant and was a Federal Choice Neighborhood Grant team. The collaborative was supported by a wide range of partners, including the United Way of San Antonio and Bexar County, the San Antonio Housing Authority and Goodwill of San Antonio. And in Columbus, the Wyland Park collaborative efforts were bolstered by the Community Properties of Ohio and several other private and public partnerships. I can see by the attendee list, we're all from all over, and so we know that all communities are different. No community is the same, and you can see by looking at some of the service populations that communities did not have uniform demographics. Buffalo had a high number of African-American families, but also had the highest high school graduation rate. Columbus had the highest non-completion rate, and San Antonio had the largest number of Latinx families. Before we move to the next section of our presentation, it's really important for us to note that Casey enters this work in what we call a strategic co-investor role. We define strategic co-investor as one in which the foundation provides technical assistance, the trainings and those peer learning opportunities to build upon the existing efforts in those 3 communities. And so with that strategic co-investor role front and center, it was no surprise that we began to infuse Casey's own REEI journey into the ongoing initiative. And I'm going to pass the presentation baton to my colleague, Dr. Kataini Murray, so that she can walk you through what played out in the communities and how Casey approached REEI within this initiative.
Thank you, Tracy, and good afternoon, everyone. I want to begin by framing Casey's REEI work with some background on Casey's REEI perspective. REEI is race and ethnicity, equity, and inclusion. This perspective undergirded the capacity building the partners in the FCCC communities were offered and was part of the impetus for the evaluation team's examination of context and how context shapes the implementation of two-gen programming. So as this slide shows, an REI lens recognizes the role that inequity and exclusion play in communities' economic and social conditions. The vision is to ensure that all children can reach their full potential in life regardless of their race, ethnicity, or community of residence. And the approach involves data-driven, targeted strategies that support children, families, and communities with the greatest need. And the specific strategy has been around providing data and culturally responsive tools that support policy and practice changes that increase equitable opportunities and outcomes for children. Go to the next slide. There we go. Okay, so Casey's goal has been to motivate the FCCC communities to apply that race and ethnicity, equity, and inclusion lens in order to first use as a tool for tackling structural community challenges. We recognize that racial and ethnic inequities such as high unemployment and poverty, volatile housing rents, and low ownership rates, as well as poor access to reliable transportation and quality grocery stores, contribute to the educational and economic challenges that FCCC families and communities face. Next, the application of an REEI lens was encouraged as a tool for increasing family participation. Casey staff viewed parent and resident engagement as a very important equity strategy. Although family participation in the FCCC programs has generally increased with time, as you'll hear a little more about later, the three communities have continually tried to engage more families within the designated initiative neighborhoods. Casey staff anticipate that families with greater say in FCCC services and design will also then participate more and foster more sustained community change. And since, as Tracy mentioned, Casey considers itself a strategic co-investor, it offered financial and other supports around REEI capacity building, but did not prescribe specific REEI strategies. Now I'd like to just transition a little bit to give you an overview of the FCCC evaluation as a lead into the Urban Institute team's presentation. The FCCC evaluation included two main evaluation efforts. First, the strategic co-investor evaluation. This was led by the TCC group, which conducted a 7-year evaluation of the strategic co-investor approach, which essentially describes how Casey is received as a partner and collaborator in the initiative in its role as a strategic co-investor. We often call it as a shorthand, Casey's evaluation of how it is showing up in its work. We see this evaluation as an opportunity for communities to share their feedback about their experience collaborating with Casey, and provides Casey with independent analysis and feedback about how a co-investor approach is working in areas for improvement. Next is the implementation evaluation, and this is the source of the data and insights for the evaluation component of today's presentation. There are two components in the implementation evaluation. First, we looked at the process of implementing FCCC. This is an interview-based evaluation to describe how the initiative is rolling out and how it changes over time through annual reports of each community and topic-specific memos. We see this evaluation as an opportunity for communities to receive feedback from an independent analysis perspective, and allows the communities along the way to make adjustments to their goals and practices. And also saw it as a way for us to provide lessons learned about doing two-generation work in a place-based initiative, not only for Casey's internal conversations and strategy, but for the two-generation field, which is why we're so excited to present to you all today. And another component of the implementation evaluation is the cost study, which is our opportunity to look at the cost to deliver FCCC programs and services. It allows the communities to understand the cost to expand programming to new families, how to shift fund allocation for more efficient practices, and make the case for investment to show the program value. And it also provides examples that are not currently available in the two-generation field. We have some upcoming dissemination plans that just wanted to tell you very quickly, in addition to the current work that we're sharing today. We also have a partnership integration brief and cost study that will likely be released to the public in the late summer, early fall. We'll have a final evaluation report, a report looking at how we engaged community in various ways in the different evaluation components, and more proximal to today is a strategic co-investor infographic that we'll be sharing with the field. So with that, I will move to the next slide. And this again just gives a little more background on how we integrated an REEI focus into the evaluation. So again, this is being in line with our overall focus in fostering REEI and the programmatic work. We are similarly seeking opportunities to contribute to equitable outcomes through the evaluation design, methods, analysis, and reporting. Casey has collaborated with the Urban Institute Evaluation team to examine structural drivers of inequity and other external forces that shape the FCCC implementation, and you'll hear about that today. The evaluation team engaged community leads in actually co-creating the REEI report that you'll be hearing today, which really allowed an opportunity to engage the communities in an evaluation process that promoted transparency and gave them voice in the content of the report, allowing them to co-interpret the findings as well. And we really saw the REI report as part of a mutual learning effort for FCCC. Through that process, we created spaces for learning conversations about the lessons learned, as well as capacity building on ways the community can share report findings with key stakeholders to advance their work and sustainability efforts. And now with that kind of brief overview of the evaluation components and how we've tried to layer in equity in those components, I would like to introduce Sue, but I believe that we have a question.
Yes, this is Jeannie, and I wanted to raise a question for Tracy or Katini before Sue dives in, and really just sort of, can you kind of answer the question? You had these place-based 2-gen initiatives, and you began to go very deeply into REEI support with them. And what was explain to the participants real quickly, what was the driver there? Like, there could have been so many things that you could have gone deeper in. You could have probably, looked at, housing or early childhood development, or tell us a little bit about how you landed on, we really need to support these 3 communities in an REEI journey. Just talk a little bit more about that.
Tracy, you want me to start?
If you could start, I'll add anything to what you have.
Okay. So part of this is really seeing REEI is embedded in everything we do. So there were various opportunities for technical assistance that were offered, even in some of the areas that you mentioned. And Casey was not prescriptive, really trying to let that technical assistance be demand-driven as part of the strategic co-investor approach. So the idea with REEI was to really think about it as the lens by which all the work should be seen through, should be approached. And so it was intended to be kind of, rather than an add-on, but really, fundamental and foundational to how the communities saw their role, and even in the TA, how you could layer in thinking about racial equity and inclusion. So I would say, it definitely was going deep, but it really was intended to just be thought of as this is how we do our work, bringing this racial and ethnicity, equity, inclusion lens.
I would only add that when I think about, housing and education and the workforce, when you're having those conversations in the community, a lot of times race, equity, and inclusion issues arise. And I think it's important because of the topics that we were talking about and how common it is for that to be a barrier or a challenge for some of the participants. I think it was really important for us to infuse it into the initiative.
Thank you so much. We'll hand it back to Sue.
Hey, Hyacinth, I'm assuming you're moving the slides. I can't, thank you. Well, good afternoon, everybody. I'm going to be talking about some of the structural issues and how the context in which these different initiatives took place. So if you move to the next slide, thanks. So we looked at 6 different domains. I think all of this feels a little bit dated now because the pandemic has overtaken it, but I'm going to be talking a little bit about how that has evolved, about what we know. But these are all different issues that sort of structural issues that community change initiatives have to deal with. And I'm going to talk about the challenges and how they affected these 3 communities. And then at the end, talk a little bit about the kind of creative responses they had to trying to make change for families in the face of all of these different challenges. And I think a little bit, and Tanja certainly will be talking more about that than I, how they've had to continue to adapt very rapidly over the past year. So we're going to be talking about housing, which remains, I think, the greatest challenge, the local economic circumstances, transportation, schools, early child care and education, and federal policy, which has been changing very rapidly during this period, the 7 years we've been following the 3 communities. If you could go to the next slide. I said that housing, I think, is the biggest challenge. I am saying that in the context of thinking about today, as the eviction moratorium is expiring, and what we know is it was already a huge challenge. You're talking about communities that have long histories of racial segregation and redlining. The 3 neighborhoods, or the 3, they were bigger areas than neighborhoods, but the 3 areas that the communities were targeting were all communities that historically had been racially segregated. They were long neglected, underinvested, and all were now facing some gentrification. That was especially obvious in Columbus, but it was becoming increasingly obvious in San Antonio and even Buffalo as well. There is and was a shortage of, before the pandemic, we were already in the middle of the worst affordable housing crisis since the Great Depression, especially for quality affordable housing. People were paying extremely high rents, very rent burden, you're going to see that in a minute, and really struggling. A lot of doubling up and a lot of people who are unstable because of eviction and things like that. And I think we're seeing all the consequences playing out now. There is the structural problem of jobs not paying a housing wage that allows people to afford a decent affordable housing. There is a lot of mobility in and out of the 3 communities as people go in search of affordable housing. And all of this has been exacerbated by the pandemic. And we now face what they're calling a tsunami of evictions as the moratoriums expire around the country. Go to the next slide. This just gives you a real illustration of what we're talking about. This is actually last year's data. This year's data is out already. National Low Income Housing Coalition puts out a report every year with what the housing wage, which is what they're saying it would cost for someone to afford a modest 2-bedroom rental. And you can see in none of the 3 communities is it possible for a family to be able to afford a 2-bedroom rental when they're making the local minimum wage. That's actually true across the entire country. It's not just the 3 FCCC communities. There really is nowhere in the United States where you can afford a 2-bedroom unit making the minimum wage. And you can also see that we have a shortage of housing assistance that existed before the pandemic and is worse now. There are long waiting lists for housing assistance in all 3 communities. It's longest in Buffalo, but it's bad in all 3. It's just a footnote that San Antonio has been making emergency housing assistance available very quickly during the pandemic. I know other communities have been doing things like that as well, but it's very challenging for the housing agencies to keep up with the level of demand. Before the pandemic hit, only 1 in 5 people who were eligible for housing assistance was receiving it. Now, of course, the number is lower. You can go to the next one. This is speaking to why people are having so much trouble affording housing. Most of the available work in the communities, in all 3 of the FCCC communities, and again, this is not just specific to them, it's a national problem, structural problem. Most of the work that's available is low wage, especially in the occupations that are available to people with low educational attainment. So in Buffalo, you also are looking at people who have high costs, especially for transportation. Getting to jobs is really challenging. I think about, I spent most time in San Antonio, so they'll keep coming up as my example, but it's a really sprawling place. It's a spread out city. People sometimes have to take 3 buses and spend 2 hours getting somewhere in order to go to work, drop their kids off at school, get to a training program. Buffalo is a lot smaller. People there were still traveling long distances because of the inadequacy of public transportation. And I think we heard in Buffalo, people were even having to walk long distances to get to places or get to training programs, get to food assistance. It's a chronic problem. Sorry, I'm doing my best here. Can you hear me now? People also have life responsibilities and gaps in basic skills that make it hard for them to progress in education. And there's just, as I said, inadequate public transit for where the jobs are located. It increases people's costs. Can you go to the next slide, please? We also looked at some of the challenges around the school systems, which of course we all know are bigger now. The insufficient school funding and lower school readiness are continuing effects of long-standing racial and economic inequities in Black and Latinx communities. You see that in the 3 FCCC communities. San Antonio, there are multiple school districts. The school district that serves the FCCC dual generation community is one of the highest poverty school districts in the city and had been historically under-resourced compared to other school districts in the city. You see that some of the schools in the areas in Columbus and Buffalo have been underinvested. That was one of the big efforts that both Buffalo and Columbus put in, was to try to invest in the local schools and bring in more resources in San Antonio also with their Promised Neighborhood. They also are facing sort of bigger pressures from federal policy around and local policy, state policy around high stakes testing, that schools can lose their certification or can lose extra assistance if the kids are not scoring high enough under the No Child Left Behind law. There's also the issues of school choice. This is a real problem for a local initiative. You're probably seeing that with a lot of community change initiatives, that if you're trying to serve kids in a particular school and the parents are choosing to send their kids to a school that's somewhere else because they think it's better, then you're going to have less chance to try to influence outcomes for those families, for those kids. And that also adds the extra challenge that given the poor transportation systems, parents have difficulty with getting their kids to where they want them to go to school. They sometimes have kids going to multiple schools in the same area and are spending hours dropping the kids off in different places. And so there are a lot of challenges. This current sort of fractured school system we have is presenting a lot of challenges for people who are seeking out the best opportunities for their kids. The next slide, please. A big problem in all 3 communities was the lack of child care, particularly for very young children. The child care subsidy system only supports about 15% of the families who are eligible. So like housing, there are a lot of people who need it who aren't getting it. Child care slots, especially for very young children, are expensive for people to operate. Head Start and early Head Start programs increase access, but they might not fit parents' work schedules. They're only open traditional hours. They might not even be open till 6 o'clock. I think family and friend care can be unreliable if somebody gets sick or somebody can't come in that day. But we know this is really a critical need, because we know quality care is critical for improving child outcomes. So San Antonio put a lot of effort into improving the local child care system, really strengthening the local providers, and trying to strengthen some of them to open more slots. And even with everything that they did, there was still a huge shortage in that community. So it's an uphill battle. And we saw in Buffalo that they really focused on trying to improve the local child care. They invested heavily in the local early childhood program. And by the end of the intervention, they were opening a second program. And still the need far exceeded the number of slots that they had. So it's kind of an ongoing struggle for all of these communities. I think Columbus had the most difficult time bringing in early quality child care, affordable. And I think that's just something that it's both structural and a cost issue. Next slide, please. So this is one of the biggest challenges that we saw during the 7 years, is the rapid changes in federal policy. The sort of continuous policy changes in the Trump administration have led to a lot of uncertainty. Obviously, the pandemic has worsened that situation. Communities couldn't count on things like funding they were counting on coming through for housing, for child care necessarily. Sometimes things continued as usual, sometimes they didn't. There were threatened and actual cuts to the safety net programs. There were more stringent work requirements put on people who were getting food assistance. There were threats to do that with public housing as well. There were threats to the Affordable Care Act. And there is no Medicaid expansion in Texas, which was a challenge, meant a really big challenge for the dual generation program throughout the 7 years in getting access to health and mental health care for people who needed it. I'm sorry, I'm trying. Is that better? I don't know what to.
So we can hear you. Please go right ahead.
Okay.
Yes.
There were threatened cuts to special programs like AmeriCorps and Vista that as communities counted on, especially to have staff. And then in San Antonio, the immigration enforcement led to community fear. That was a real challenge. It was a challenge for the food assistance system. All the things that are happening now around COVID, around the police and the protests are certainly making more challenges for the communities as well. You can go to the next slide. I think one of the things that we saw through this, so, you know, the structural problems are real. The legacy of structural racism, the ongoing pressures, and the crisis that we're all in have been a real challenge for these communities. And it was really heartening to see how they responded and really tried to do their best to help families navigate in this context, which is what they can do, right? They can't fix all those big problems, but they can try to address things for the families that they're serving. So they all offered training, certification programs, and adult education to try to help people improve skills and improve their wages. They located the services close to where people live, which is a really important step, because a lot of times big programs are expecting people to take those 3 buses to get to the training program or to the community college. And to be able to go to something that's in your community for people who don't have good access to transportation and have the services offered by people who are familiar and comfortable really matters. They offered bus passes and emergency transportation assistance. They really strove, especially in Buffalo and San Antonio, to improve the quality and availability of childcare and early childhood education for the families. Doing everything from actually opening child care centers and funding them themselves to providing for training, and to providing training for people who are doing in-home care in San Antonio. In Buffalo, they really focused on expanding the affordable housing, which I said is the sort of biggest challenge that's overlaying everything. In Columbus, they worked a lot with the school district level leaders to bring more resources to their community and really improve the local school. That partnership increased over time. And in San Antonio, they continuously work to bring on new funding and new program partners to expand the number of options they could offer families to expand the footprint they were working in. By the end, by I guess the midpoint actually of the 7 years, they had expanded to 10 zip codes of the city. So they were really expanding their reach. Next slide. So I think the things we saw that were really heartening and important, especially in today's context, is the persistence, flexibility, and resilience that these 3 initiatives showed, adapting to different circumstances constantly, and really trying to adjust and meet the needs of the families that they were trying to serve, and listen to where they were, to find out what they wanted, and adapt to their needs. Acknowledging the structural racism that underlies the contextual challenges is something that is really key here. I think it's important in this moment that we're in. The poor housing, the racial segregation, the lack of investment in affordable housing, that didn't happen by accident. That was the choice. We have been building lots of high-end housing over the last couple of decades, although there's a shortage of that too. We certainly have not been investing in affordable housing. We haven't invested much in public housing in several decades, so it's just sort of all the way up and down. The lack of, and we haven't raised the minimum wage, I think, in 2 decades, national federal minimum wage. The lack of quality child care is another policy choice, and it's something that hits poor people of color the hardest. The struggling schools and the lack of investment in schools in poor communities of color. So I think this is a transition into what Marla's going to talk about, but because these communities were part of the Casey initiative, there was the training that they got on racial and ethnic equity and inclusion. And I think that enables them to advocate for real and meaningful systemic change, or the hope was it encouraged them to. So I'm going to hand the baton over to Marla, and she's going to talk about what that training was like and how it played out in the 3 communities. You are on mute.
Okay, can people hear me now?
Yes, we can hear you.
Okay, thank you, Sue. Okay, great. So as Sue said, now I'm going to actually turn and talk about one of Sue's last bullets on the previous slide, training staff on racial and ethnic equity inclusion and what has come of it. Okay, so much like Sue just described as the contextual backdrop where we find the FCCC communities, the Annie E. Casey Foundation wanted the role that inequity and exclusion play in the FCCC communities to be front and center in the work, as Kentayani and Tracy described earlier. Next slide, please. And as a reminder of what REEI is, I want to focus on the definitions. We say each of these words all the time, but to understand the concept, we have to really appreciate their weight. So race is socially constructed, and it's been a basis for discrimination and domination. Equity is about being just, impartial, fair, and it's a structural concept. So it's not just, do I treat you fairly, but are our institutions and systems set up to treat you fairly? And inclusion, that involves authentic and empowered participation to the point of a true sense of belonging. And I'll say that again, a true sense of belonging. Next slide, please. So how do we get there? So the foundation introduced 7 steps to advance race equity. First, begins with understanding the concepts of REEI. Second, engaging affected people and stakeholders. Third, collecting and looking at data by race and ethnicity. 4, analyzing the root causes of inequities. 5, identifying strategies and targeting resources to root causes. 6, assessing all policies and decisions for their impact on race equity. And And then 7, continuously evaluating and adapting strategies. Next slide, please. So now we're hopefully all on the same page with terminology. As part of Urban Institute's study, we wanted to understand how the FCCC communities received, how they took in the concepts of REEI in their 2-generation work. We took a community-engaged approach to drafting our findings, and we worked very closely with each of the communities to share what we were seeing and get their reflections so that we could really capture the nuance behind the motivations, the opportunities, and trade-offs behind their decisions and their responses to REEI in their 2-generation efforts. Next slide, please. To give you a quick overview of the trainings that the communities received. In 2015, it was the first training, and it was held during an off-site FCCC conference convening. It focused on race, racism, power, and group dynamics, and each community team had brought between 6 to 10 people with them. So it was a relatively small share of the FCCC community teams. In 2016 was the second training, and this was held locally in each of the communities. It focused on language and discussing REEI, and it also included discussions of each community's local history and of racism and discrimination, especially in housing, and it introduced tools for analyzing racial equity. And for this, all 3 of the communities had between 8 and 20 people. So it was more members of the FCCC community teams, but it still wasn't everybody. From 2017 to 2019, which is the end of our study, communities participated in additional trainings periodically. Sometimes these were funded by the communities themselves, sometimes it was funded from Casey. Most of the focus in the last couple of years was on concepts embedded in their work, such as trauma awareness training and how to apply the REEI tools to the FCCC policies and practices. Next slide, please. So before going into some of the outcomes of the trainings, I wanted to mention the racial and ethnic backgrounds of the team members. So Buffalo and Columbus, and I believe in earlier presentations, they discussed the demographics, the overview, but Buffalo and Columbus teams are not unlike many human services and community-based organizations across the country. Predominantly white-led, with middle management, frontline staff, and parents more racially diverse, both African-American and white. In San Antonio, leaders and frontline staff were racially and ethnically diverse, African-American, Hispanic, Latinx, white. Next slide, please. So here are 2 quotes that give a taste of people's reactions, their feedback on the trainings. So the second 2-day training was very systems focused. Like, these are some things you can do in an organization to change hiring practices, et cetera. The first one, the training, was very individualistic, looking within, recognizing, am I part of a dominant group, non-dominant group? Being able to look inwards to recognize I'm a minority or I'm not. A second person said, I'm not used to thinking about race because it kind of overlaps with poverty. Everyone we serve is highly impoverished. The systemic issues are something to think of. Why it's so messed up? There are reasons why. And that was the relief. Next slide, please. So here's a figure from one of the trainings that stuck with several people, even several months after. Some grasped the difference between equality and equity more fully after seeing this image. Equality is giving everyone the equal sized box, but equity is making sure everyone can see the game. Many FCCC staff and partners felt the trainings, quote, happened at the right time for the communities, and for FCCC, given the right time for the communities and for FCCC, given the racial dynamics and inequity in the neighborhood. People liked that there were people of different backgrounds at the trainings. One person said the variety of people who were in the room that day with different backgrounds and different jobs could talk about their experiences. We don't get a lot of space to talk about that. It affected our organization for the better. There are also some constructive critiques. Many people said the trainings were heavy. Several wanted more tools and resources for applying REEI principles, and most everyone wanted more on their teams to hear it. They wanted more executive leaders, more decision makers, direct service staff, and community members to be able to attend. Next slide, please. Okay. So here are lessons from the trainings. Becoming more self-aware and vulnerable. The trainings intensified self-awareness and also vulnerabilities, particularly for those who already experience racial discrimination. The trainings also raised issues for some that the community teams were not equipped to address. Some wondered how to create safe spaces for people from different backgrounds and levels of power and authority to discuss challenging topics. The topics also surfaced underlying tensions, fears, pain, and vulnerabilities. A second lesson was that inclusion is context specific. All of the teams were very thoughtful about what inclusion and cohesiveness could and should look like. And they observed that real inclusion is likely more complex in communities with greater racial and ethnic diversity. And a third lesson was seeing value in using an equity lens. Even though it was hard, many reflected that having an equity lens is critical for making sound decisions and policies that affect people. Next slide, please. So the FCCC community teams, Urban Institute, and the rest of the evaluation and resource teams, plus the Annie E. Casey Foundation, met over a year and a half after the initial trainings and brainstormed about ways to advance an REEI agenda in FCCC. And what we did was contemplate these three questions. Now, as I read these, I want you to please feel free to start typing into the chat, if that is possible, how you might answer these. And we'll turn back to it. We have these questions on another slide again that we'll pull up later. But if you're interested, I'd be interested to hear what you might be thinking of. But the first question is, how would you recognize a community living the REEI principles if you saw one? Among the FCCC community teams, we talked about power is, in these communities, power would be shared differently. Government philanthropy would invest to bring communities to equal footing. Data would be analyzed deeply, numbers not taken at face value. Communities would examine racial and ethnic dimensions and consequences. The second question, what does a community that's applying an REEI lens look like? Some people said communication is transparent. It doesn't use proxy terms such as poverty when we're really concerned or talking about race and class. Third question, what does a community that has achieved racial and ethnic equity and inclusion look like? Some people said it's constantly evolving and evaluating how well it maintains racial and ethnic equity and inclusion. It's a dynamic process. Next slide, please. So the FCCC teams generally concluded that to effect real change beyond shaping the FCCC initiatives, each community would need to engage local policymakers. That is, addressing the structural barriers for FCCC families would mean tackling city-level issues around racial segregation, economic disinvestment, and inequities across major systems, many of which Sue talked about. But to date, however, this level of engagement has been beyond the scope of FCCC's work. So given the perceived barriers to changing major systems, the FCCC community teams concluded that they first need to lay groundwork before building a true foundation. And so together, the team came up with 6 simultaneous pre-action plan steps that they felt were in the team's immediate control. And so this is what you see in this figure here. And I will briefly say what each one represents. So engaging, it means investing sufficient time in engaging and including all stakeholders in the process. Defining, meaning to create shared definitions and language for discussing topics of racial and ethnic equity and inclusion. Learning means to invest in ongoing trainings and learning opportunities. Tracking, collect and use data to track progress and improvement. Framing, we talked a bit about this, knowing the intended audience and stakeholders and how to frame what roles they play in building racial and ethnic equity and inclusion. And then last and most importantly maybe, doing the work by starting with themselves and practicing what they plan to help others also come to do. Next slide, please. So since the initial trainings, the FCCC communities, as I've mentioned, they've continued reflecting on and receiving REEI trainings. But still, over 4 years since the introduction, teams struggle with how to infuse REEI throughout their programming. So in pre-action step terms, we would say that the teams have focused mainly on learning and by extension engaging, but have admittedly made less headway defining, tracking, framing, and doing REEI. So all three teams have faced challenges in translating the trainings into new practices and systematically involving parents and other community members in more inclusive ways. You're going to hear a lot about inclusion of parents in our next presentation, but in terms of decision-making and leadership and designing of the overall programming. Others have reported difficulty exposing enough staff at all levels to the REEI perspective, especially with staffing changes. So making sure that everybody is constantly aware of and understanding the concepts. And then third, there were general obstacles prioritizing REEI over other programmatic gaps, such as building stronger linkages to mental health resources. And this was a need that all three of the communities identified and were focusing on, especially toward the end of our study. So here are the key takeaways that the three teams would like to leave with others. Involve stakeholders, use shared definitions, provide and receive training, use data, attend to framing an audience, and set the example. And for my last slide, I want to leave this up. How would you answer these questions? So I don't know if anybody ventured to send anything. Let me see if I can see if we were able to get any comments on that.
So Marla, while we give folks a minute maybe to answer in some questions, we did get some other questions related to your portion of the presentation. So I think a very prominent question, can you talk a little bit more about how some community action agencies might be able to receive the REEI training, and are you aware of any funding or scholarship opportunities for agencies to think about how to apply this within their organization and to the work that they're doing in their community?
That's a great question. It's actually probably a great question for our partners at the NeighborhoodBased Foundation, since they had identified and brought the trainings in. So I don't know whether Tracy or Kantayani, is that something you would be able to address?
Yeah, I think the interesting thing is, as Sue mentioned, this is pre-COVID, the current moment we're in with race, equity, and inclusion around the globe. And I think what I found most interesting in the past few months is the philanthropic space really stepping into race, equity, and inclusion.
Oh, Tracy, it looks like you're muted.
I'm sorry. Did you hear any of what I just said?
Not the last part. We heard like maybe your first couple sentences, but that last part that looked really good, jump into that.
Yeah, I was just saying that a lot of foundations and funders have really stepped in and into the race, equity, and inclusion social justice space, even if it's not like their primary funding opportunities, but recognizing the need for additional supports. And so I would say before even thinking about new funders, thinking about what are your current funders doing, because a lot of funders are pivoting and including whether it's capacity building or trainings around it. And so I would say that. The first part of that question I didn't hear though. I know it was about opportunities for additional funding and support, but there was another piece of that if you could repeat it, I would appreciate it.
Sure, just how can agencies get connected to receiving the training?
Well, this training, I believe, was like specifically for FCCC. The Annie E. Casey Foundation as a funder provides a lot more than just funding. There's a lot of different resources. As we talked about, the strategic co-investor role for us was about coming into the space and helping support where we could with an existing initiative and being able to bring our own expertise and leverage it when appropriate and necessary. And so as we built out our race, equity, and inclusion work, it made sense for us to, and given, as I said earlier, the topic areas, it made a lot of sense for us to infuse it there. So our trainings, the trainings that we did specifically for this group aren't necessarily available online, but you can check out our website, the Annie Casey Foundation's website, and we have a whole like toolkits about race, equity, and inclusion, and a lot of different resources online.
Zandy, this is Jeannie. Can you hear me?
Yes.
Yeah. So I just want to flag, we'll keep moving ahead. We're going to have more time for questions and comments a little later. But one thing I would just want to call out right now, that the partnership is really curating a lot of resources for, racial and ethnic equity and inclusion. And some of those resources have already been posted on the partnership website. So when we send out the follow-up materials, we can point people to that direction. But there are a lot of good resources out there. Our Annie Casey may have used a particular training module for the FCCC grantees, but we can also help people connect up to a lot of things that are online or available in their community. So we'll do that with our follow-up.
Thank you for those answers. It looks like folks are putting some things in the chat related to these questions that we have. But maybe what I'll do, because it looks like they're being sent to all panelists, and I do want to make sure that we give Tanja enough time for her wonderful portion of the presentation. Perhaps if folks can keep entering in your responses to these 3 questions that you see here, I will copy them and make sure they're in the chat so that you all can respond to them, because we'd love to hear your responses, and then we will move forward and pass the ball to our next presenter. So Tanja, whenever you are ready, you can go ahead and get started.
Good afternoon, and thank you all for this opportunity. Again, my name is Tanja Jones, and I am a family achievement coach with Community Properties of Ohio. And I'm going to be talking with you about Next Doors and working with the families. Welcome to Next Doors. The first thing I want to talk about is trust versus mistrust. The reason why I'm starting with this is trust or mistrust is the foundation in which you are able to work with the family and move forward. If a family feels like they cannot trust you, they'll work with you to get the things that they feel like they need, and that's it. That's a finished relationship. If they are able to develop a trusting relationship with you, you are able to coach them. You are able to give them an opportunity to be exposed to different resources that will help them move forward. One of the things that we say when we're talking to other coaches is, please don't say, you can trust me. That will send red flags up to to that family to say, what are they hiding? Why can't I trust them? The other thing about trust versus mistrust, our families love their children. It may not always look like it, but our family loves their children. And when they trust a coach or someone they are working with, they are willing to work in a 2-generation setting where they are allowing you to be a part of their children's life. How do we build relationships? How do we build strong working relationships? There are several ways to do so. Here are a few ways that we have found to be effective: authentic communication, respect and integrity, and acceptance. Before I go into those 3 parts that I've mentioned, I'd like to talk to you about the strong relationship. I'd like to talk to you about the strong relationship. During the protest, our families have had a lot of challenges. And so during this time, we have really tried to work with our families and to be a support to them. We just wanted to share with you all what some of the families have said to us, what we've heard. I'm not going to read all of them. You can read those. One of the things that I would like to highlight is when a mom said, "Man, I got to teach my son to survive at 6. This world is effed up." That is one of the challenges that we have to continue to talk to our families about when we talk about the protest, which helps us to continue to build on the relationship. What are the coaches' responses? We try to make sure that we are affirming their feelings, letting them know it's okay to have your truth. We encourage them to be honest with themselves. If you're angry, if you're frustrated, if you're scared, all of those things are okay. We invite the residents to seek out knowledge. Unfortunately, a lot of the residents we serve, they see Facebook as the gospel. That is the truth. And we try to expose them or encourage them to be exposed to other resources so that they can get knowledge from other places and then come to a conclusion that works for them and their family. Continuing to have authentic communication with what's needed to be communicated. Authentic communication. One of the things that we talk about with authentic communication is families have been around long enough to know when someone is not telling them the truth. They know when people are not being honest. So we talk about in coaching the importance of honest communication both ways. We have to be we have to communicate with our families with the utmost honesty because we are expecting them to do that as well. Communicate the truth. As uncomfortable as it may feel, all people want to know the truth. One of the things we talk about as coaches, we challenge ourselves. If we know we are getting ready to have a very difficult conversation or a challenging conversation with a family and we are not feeling uncomfortable before or haven't had any uncomfortable feelings during this conversation, we then have to question ourselves, how authentic was that communication? Was I being honest with them? Was I being honest with myself about the information that I was sharing with them? Respect and integrity. Respect and integrity have to run into each other. You can't have respect, you can't have integrity. When it comes to coaching, we have found that they have to run into each other, they have to blend with each other, they have to bend each other, they have to be hand in hand, they have to be twins. Respect what is said. They really know. Sometimes when we are talking with our families, we don't want to respect what they're saying because we already have a preconceived notion that that's not the truth. We have to respect what the member or the resident or the person we are serving is saying because they really do know their truth. Respect the knowledge that they have. They understand their situation. We often say to the families that we work with, I'm here to support you. I'm here to try to help you. I am here 8 to 5. When I'm not around as your coach, you have to live your life so you know the best possible solution for your situation. Integrity. Do the right thing. It's just doing the right thing and knowing that we have the privilege to serve. When we come into a situation with we have the privilege to service the families that we are working with, our attitude is better and we tend to treat people with integrity. Honor your word. Do not knowingly promise or underdeliver. One of the things that our families experience on a regular basis is when they go to a program or they're a part of a resource and a person's like, oh, we're going to do this and you can count on us to do that. And the families are looking forward to having those resources to only find out, oh, I overpromised, now I have to underdeliver. So we talk about respect and integrity and how they have to come together. We have to do what we say we're going to do, and we have to be honest and truthful about it. Acceptance. When we are working with our families, it is so important that they feel accepted for who they are, where they are. One of the things we try to make sure is we meet people where they are when they come into coaching. Everybody's on different levels. Everybody has had different experiences. Everybody puts together action step goals and action steps very differently. One of the things about acceptance is we have to know when our families come to us, this is what they say to us on a regular basis in various forms. Who I am is who I am. They're not saying that to be belligerent or stubborn or resistant. Who they are their life experiences, what they've experienced as a child, what they've experienced as a woman or a male, what they've experienced as a mom or a sibling. Who they are their life experiences. One of the things in coaching that helps us to really keep the families in the forefront is we have to let them tell us, when they say to me, let me tell you who I want to be. So many times as coaches, when we hear different people's stories, we have this idea of, oh, this is what you should do. Oh, this is who you should be. Oh, you're really good at that. And they'll say to us, let me tell you what I want to be. Let me be clear on where I want to take my family. And we have to honor that. Please do not tell me what you think I should be. The families that we have served have repeated this to us several times. Ms. Tanja, it doesn't matter what everyone else thinks I should be. Let me tell you what I want to be, what I'm going to be. And all of those things are learned from their learned experiences, from their exposures of different experiences, positive and negative. One of the things that we try to remember is a person can relearn a behavior. A person cannot unlearn their experience. So with coaching, we never forget that coaching is not dictating what should happen. It is supporting while things are happening. We also try to remember when a strong relationship is present, People will allow you to coach them. We don't just get to coach people because they sign up to be in the next door's project and their kids go to this school or their child attends this daycare. We don't get to coach them because of that. A lot of our success comes from coaching individuals who allow us to coach them because we've worked to put in that we've worked to develop a positive working relationship with them. One of the things that has challenged us during our coaching is the COVID. We have had to really, really, really look at our families and identify how resilient they are, how quickly they recover. A few challenges that our families have had is the threat of the stability of their housing, their children's education. They're missing so many schools. The family mental wellness. Some of our families have been attending colleges, and this was their first time attending college, and once they got into the rhythm of attending college, now they have to do online. Where am I going to get a laptop? How am I going to pay for internet? Bills being paid, food source, physical health of the family. And one of our big things is transportation. How do I get my family from here to there safely if I have to use public transportation? The action steps that we continue to take with our families is communication. It is so key. Open communication, often reaching out to the families, communicating to them, what is it that you have need of? How can I help you work through this? We have texting conversations, FaceTime conversations. We help the families develop daily schedules so that the children know what to expect throughout the day, the adults know what to expect out of the day. We also help them develop a budget that they have not normally needed so that they are able to pay bills, so that they are able to stay as close to on top of things as they can with the income and the resources they have. We also had a lot of conversations about cleanliness. How do we help each other stay safe in our homes and in the community? Coaching techniques. There are many, 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 many techniques. What we have found to be helpful, useful, and move us forward, and they're all intertwined. We use motivational interviewing. We use trauma-informed practice, and we use a form of empath mobility mentoring. When we talk about motivational interviewing, that simply is saying we are working with the families, talking with the families, helping them to come to a place where they start to make the decisions that they need to make so that they can move their families forward. Trauma-informed practices. Instead of asking the question, what's wrong with you, we always want to ask, what happened? We want to make sure that in our coaching, we are not re-traumatizing or causing a traumatic experience for the family and the children. And then the mobility mentoring, that's where we come in with the incentives and goals, action steps, barrier removals, helping them to access financial resources within our project to help the family move forward. This has been a really, really rough year. We, this year, had an opportunity to have one graduate, and so I wanted to make sure that we highlighted our one graduate, our 2020 graduate, who has been accepted and will be attending the University of Cincinnati, Ohio. My name is Tanja Jones, and on behalf of all of the Next Door members and coaches, we thank you for your support, and again, we thank you.
Thank you so much to all of our presenters today from the NEEKC team and from the Urban Institute, and also Ms. Tanja for joining us and closing us out in a wonderful conversation looking at what the work looks like on the ground. I might turn things over to Jeannie. I think you had a couple questions to pose for us while we give our attendees a chance to enter in any additional questions they might have for our presenters.
Sure, I'd be happy to sort of kick us off while folks put in the chat, or if you are easier to put it in the Q&A, questions that you have for any of our speakers. So in case folks aren't looking at the chat, I just want to reiterate something that I posted a few minutes ago, which is, you know, it's really great to hear about both community level work, community change work, and family work. And in reality, we really have to attend to both of those levels of change to have the kind of impact, I think, that we want to have in community action. And, you know, we know that kids live in families and parents are workers and families live in communities. So when we are doing a whole family approach, you know, we should think about a whole community approach too. So it's really good to hear both levels in this webinar today. I guess I would ask our colleagues from Urban, I think from Urban, what if you sort of had to zero in on a key lesson that, you know, you think is relevant to the moment that we're in, sort of looking at the research that you all did and sort of understanding the current conditions, because we know the research you did was a few years ago. What lesson would you zero in on now in this moment? Where do you think the heat is as far as what you learned in your research and what might be useful to folks today? What would you call out for us as we wait for additional questions?
I have a thought. I can jump in. You know, I think as it relates to the work on racial and ethnic equity and inclusion, I saw that chat, and sorry that we started using the acronym and not everybody saw it from the beginning. But from that work and the discussions that the teams ultimately had about who was missing around the stakeholder table when they were trying to really apply some of the lessons that were coming out of the trainings, and it relates to what Sue was talking about in terms of context, but making sure that, you know, when you're thinking of these collaborations and these partnerships, and if you're really serious about community change, building in connections and collaborations with policymakers from the very beginning, trying to loop key decision makers, you know, people who can also help grapple with the larger structural conditions that families and the communities and organizations working within them will ultimately be facing.
Great, that's very helpful. I think I read that in one of your reports too, that the importance of having policymakers at the table, and I think we would all agree. Tiffany, I think you might be on the line, Tiffany Marley, and I'm not seeing any questions coming quite yet. So I know that you've got some resources coming up that you might want to call out. Can you unmute yourself and share those with us quickly?
Yeah, so in the essence of time, I'm not necessarily going to be able to highlight all of those, but I will put out an invitation to folks, 2 invitations for that matter. One is on August the 12th, myself and Denise Harlow will be facilitating a webinar called Applying the Racial Equity Lens to this moment, a resource tour. So that's a great opportunity to go deeper into the various resources that we have curated in the racial equity space. As from our perspective, we are really baking in all strategies that cultivate belonging and cultivate just that attitude of creating opportunity for all of the customers that we serve and the communities that we serve within our network. In addition to that, I did see that there were several questions and requests for training and follow-up. And as the partnership lead on our equity work for the network, particularly racial equity, I would invite you to contact me directly. My email address is tmarley@communityactionpartnership.com. Happy to provide a conversation, technical assistance, and for sure, myself and other colleagues have gone out into the field to facilitate racial equity trainings for local agencies as well as associations, and our portfolio is continuing to grow in this regard. And so, again, just want to thank everyone for your participation today. I'm very grateful to this team that presented to us, who just really surfaced the important issues that are alive and well in our communities as we are aiming to support all families in achieving that social and economic mobility. So thank you. Hopefully you will reach out to me. Look forward to hearing from you. And Jeannie, do you want to give the final word, or am I the final word today?
I will say one final word, and then I think Zandy had something she wanted to share for one of our panelists. So I just appreciate the great attendance today. So many community action folks interested in this subject. It was really gratifying. The work that Annie, Casey, and Urban and Tanja have done to bring this to everybody today. Under what I know are difficult conditions for everybody, the world is very complex. And so we appreciate their generous time. And then, Zandy, I'll hand it off for you for that final sharing.
Sure. Thanks, Jeannie. I just wanted to share a comment that kind of closes and highlights on Ms. Tanja's presentation to us. But one of our attendees wanted to say that they really appreciated the integrity, respect dynamic that you talked about. And it's just important to underscore how important it is to be honest with what you're providing to families in this context. It is so true that under-delivering leads to disappointment and frustration with our constituents. And I very much appreciate you sharing your thoughts with us today.
Everybody take care and be safe. Thank you.